Everyone. Okay, we'll start in a few minutes. Okay, just letting people trickle in, and then we can get started. Okay, we can get started now. Welcome everybody, and thank you for joining our Ensuring Workplace Safety in the Healthcare Industry webinar. If you are new and joining us here today, we are Imperium Dynamics, a proud Microsoft partner dedicated to bringing your vision to life within the Microsoft stack. We help organizations of all sizes achieve digital transformation by solving complex problems and delivering long-lasting impact through the Microsoft Cloud solutions, with a focus on increasing both the capabilities of people and the performance of businesses. So this is a quick overview of our agenda today, where we will address common workplace hazards, how to identify these hazards, as well as highlighting short-term solutions for hazard mitigation, and leveraging job hazard analysis, including a live demo, benefits of our job hazard analysis tool, and finishing off with a Q&A. But before that, a few housekeeping items. The session is being recorded, and after the webinar is over, you'll receive an email with the link to access the recording. So feel free to revisit it or share it with your colleagues. There will be a Q&A session at the end, so please feel free to submit your questions throughout the presentation using the Q&A chat feature, and we'll address as many as possible. We'll also be sharing additional resources and a copy of today's slide deck, so you don't have to worry about taking detailed notes. With that said, let's dive right in. Joining me today is our VP of Product, Sarah Camden-Howe. Welcome, Sarah.
Hi, everyone. Thanks for joining us. I'm Sarah Howe. I'm our VP of Products at Imperium, leading up our product team, which builds different ISV solutions to solve industry challenges. And I'm looking forward to speaking with you today.
Great, thank you. And my name is Brittany Rivera, and I am a marketing specialist here at Imperium Dynamics. And I am also very excited to be presenting this webinar for our healthcare professionals. So before we talk about solutions, it is very important to address, the key hazards that you might be going through or that can happen in the possible future. And we kind of identified four major ones. So the first one, it can be needle stick and sharp injuries, whether it is yourself or another person that you might accidentally poke that can lead to very serious infections. We can also have slips, trips, and falls, whether it is wet floors or cluttered hallways or even uneven surfaces. These can lead to accidents, especially in fast-paced environments like hospitals or emergency room. And another one that we don't really pay attention to is the musculoskeletal injuries, which can just be, the cause of improper patient handling, heavy lifting, and repetitive movements, leading to back, shoulder, and joint injuries. Another one that we also don't pay a lot of attention to can be workplace violence. So whether it is physical or verbal assaults from patients or visitors, this can lead to physical injuries or even mental health stress. So with these common hazards, how do we identify, or a better word, how do we prevent these hazards from happening? And we kind of, there's four major ways that this can be extremely effective, starting with, evaluating your environmental conditions, which can refer to assessing physical factors like your lighting, your ventilation, your noise levels, the temperature in your workplace. This can help by knowing your surroundings. So, for example, poor lighting in a storage room can lead to falls or injuries from mishandling equipment. You can also do an observation of your work practices and spaces. So, for example, your supervisor or your safety officer can observe and kind of do a walkthrough and to your steps, kind of a daily work routine to identify unsafety practices and behaviors. And this can kind of help sort of spot risks that employees might unwillingly expose themselves to due to improper technique or even a lack of awareness that they might not even be aware of. Another one is the risk assessments of new equipment and procedures. So by analyzing, your past reports to identify patterns and recurring hazards. This provides kind of a historical view of frequent risks that happen and need your attention. So you can pinpoint recurring hazards and then come up with ways to prevent them going forward. All right, that was a review and injury and incident report. And then another one, the last one would be risk assessment of new equipment and procedures. So whether you have new equipment, new medication, or even new procedures that will be introduced to your workplace, it is very important to kind of go over those, and this will help anticipate hazards that might arise from these changes. So say, these hazards do happen even after trying to prevent them. You might go through a very lengthy process of reporting an incident, particularly when submitting to OSHA, because you will need to gather accurate documentation of the incident, which can include, the environment, the equipment used, and any potential exposures. This process can involve collecting statements from multiple witnesses and reviewing extensive patient and staff records and more, which can take a lot of your time. So, Sarah, with kind of these hazards mentioned, what are some easy short-term solutions to fly through this reporting?
Yeah, so I think for a quick process, there's paper-based forms that you can download and print out from the OSHA website, and that kind of guides you through how to do a JHA assessment, where you would kind of follow those steps that you just mentioned, Brittany, of like going through the steps in the process and then listing out any risks, any hazards, and then the consequences or potential control measures for those. So that would be something that anyone could kind of do any day, and they can just find those paper templates online.
Amazing. So great insight. So apart from this, what is sort of another solution that's not only easier, but also quicker than the rest?
Yeah, so um, our job hazard analysis solution brings a more comprehensive approach to managing workplace safety. Um, it's more effective in the sense that it helps you to make sure you're being thorough when you're conducting those assessments. A lot of times people don't feel fully equipped to really think of all of the things that might be relevant for their specific role or their specific workspace, and are looking for templates that they can work off of. Templates are rare to find, if at all, in this industry, because it's supposed to be something that's custom for your specific site and process. But we have provided a very unique feature of having a library of options, so you can search and filter them based on your industry, and that just helps to make sure that you might include things that you might not have otherwise thought of. And then it's also very easy to execute. It's digitally recorded, so you can quickly and easily manage all of your approvals, and then also expirations, so that you can maintain your compliance year over year. So from an end-to-end perspective, there's kind of 3 steps in completing a job hazard analysis with the Imperium solution. So the first is that you would kind of define your assessment. So you might take a lead or a group of individuals who share a role and have them kind of set up a template of the different steps that they go through in a process. And then along with each of those steps, they can think of what hazards are applicable to that step. And those are things that can be selected from the library, and it will generate a JHA template. And then the next step would be to actually fill it out in a survey format, where the system will give you a survey based on that template that you created, and it will ask you questions that OSHA recommends that you evaluate. on things like the probability, the frequency, and the severity of those different risks, as well as PPE, control measures, any action items to take, or general comments and feedback. So the team can kind of go through those together step by step in the process. And then they can even apply the control measures and then do the survey again and be able to highlight and see kind of the difference or the current state after implementing those control measures. And then the third piece is the reporting side. So a lot of people are currently using Excel and spending a lot of manual effort to create these type of like insight and actionable reports in Excel. And here we've automated that complete process. So once you submit the survey, which was the assessment, it will automatically create this Power BI report that's telling you in a color-coded way, you know, which are the most pressing risks and hazards. And then we also have documentation for versioning, approvals, and then we also have actions and tasks that are created automatically based on these. So you can help make sure that you're following through on any follow-up items.
Amazing. Can you explain the streamline process?
Yeah, so from an end-to-end, the system is giving a very guided experience for users who are going to conduct a job hazard analysis. So it has a business process flow up here at the top, which is this purple bar with the little dots. So it says pre-risk qualification, then there's a second stage of post-risk qualification, then we have review, and then we have actions. So it's facilitating and sort of telling the individuals exactly what they need to do next at each stage of the process. And it's giving you a holistic place to view everything about that specific process's analysis. So you can have, you know, versions, you know, history, approvals, all tracked here digitally, as well as the actions and the outcomes of those actions.
Great. So how does it generate job hazard assessments?
Yeah, so there's a setup wizard in here. And when we're at the setup stage of a JHA, it's going to offer you this wizard option. If you click on that, it's going to allow you to select things like your industry and, you know, the job role that you're making this survey for. And then when you move forward, it will then it will prompt you to list out the steps in that process. And this is where we get that library experience that if we scroll down, we can see thousands of relevant options for our industry. You can search them, and then you can also scroll through them and select the ones that are relevant. So then after you've picked those options for the steps, it will then prompt you for each of the steps that you have mentioned to choose the relevant hazards as well. And then based on that, you'll be getting your customized job hazard analysis template.
Amazing. And can you explain how do these assessments run?
Yeah, so these are run, there's two options for taking the assessment. There is a portal option that would just be a web portal. You can sign in using your Azure AD login, or you can take it in a Canvas app as well, which is something you could embed within your Teams, or you could open it within your browser. And it's going to prompt you in a survey style experience where you just have to kind of think about each question one at a time, answer them, and then move forward through that process. And you're essentially filling out a questionnaire, and then it's storing everything on the back end and automating the report.
Great. So talking about report and data, how can we view these analytics?
Yeah, so when we come back into our model-driven app within Power Platform, that's where we're going to be kind of managing the back end of this process. So we'll have high-level reports and dashboards that are summarizing our KPIs and metrics across all of the safety analyses that we've done. But then if you open up your specific job hazard analysis, once you've completed the pre-risk and the post-risk, it will automatically show you upon opening that record the job hazard analysis report, which has all of the OSHA-based scoring calculations, color coding to highlight the most important ones, and then it will also list actions and then KPIs as well.
Amazing. So Sarah will now actually provide a live demo for us. I can quickly unshare, and then you can share a presentation.
Perfect. I'm just waiting to get the share option enabled. And okay, there we have it. Okay, so I'm going to share my screen and let me know when you can see.
I can see it.
Okay, perfect. Okay, so here I am logged into my model-driven app. Are you seeing these 3 boxes at the bottom too?
No.
Okay, perfect. So I'm logged in here with my Office 365 platform-based model-driven application that I'm using to manage my job hazard analysis here. So my first step would be to really go and create a job hazard analysis record. So in this example, I'm talking about registered nurses or RNs. So if you can see here, I have my navigation in the left, and this is giving me my business process flow across the top. So I can see that, there's pre-risk qualification stage that's completed already. And I completed a couple steps during that, right? I created the survey template and I assigned the pre-risk assessment. The pre-risk was completed, and now we're at the stage of post-risk qualification where we need to implement the control measures and then retake the same assessment so we can evaluate the complete picture after we've implemented those measures. So this is kind of guiding me across and telling me what I need to do at each stage. So I can kind of see here, manage the due date, approvals, and I can see where I am in that process and what I need to do next. We can also track the actions as well, which we'll get to, and then any survey history as well from, for example, like previous job hazard analysis for the same process. So this is kind of the overall end-to-end home of my JHA. And when I'm actually going to be creating it, I would be using this questionnaire wizard here to set it up. So this is where we can come in and create that custom template for our specific process. So say I wanted to do like nurse transfers as my process. Because we know, as you mentioned, lots of musculoskeletal injuries happening when transitioning patients from room to room. Here I can select, my industry. I've chosen healthcare, and I've associated to a specific JHA. I could even choose my job category as well. So there's different types. I'm going to just say I'm a nurse practitioner. And then I'm going to move forward to the next screen. This is where it's going to allow me to choose the steps in my process. So this is where I can really kind of, I can search and filter them. Now that I've removed that filter there, I can kind of scroll through these different options, and that will just help me come up with exactly what the steps are in my process. Or I can, if I know exactly what I want to enter, I can either create a new one with the plus button, or I can just select them based on scrolling. So I'm going to pick a couple of them here. So monitoring them, and then say I wanted to say like transporting across floors. And then I'm actually able to add this data as well. And I can put what type of option it is. And I could associate it to a specific job category as well. So I'm going to select it for that nurse practitioner role that I had mentioned. And then we can go ahead and create that. So it's really easy to just kind of complete this process, choose the options that are there, and then we can go ahead and for each of those options or steps, now it's going to allow us to pick up any of the hazards that are relevant. So different hazards that could occur during such a process. We could have, confrontation or resistance. We could have the musculoskeletal, like injuries and so forth. So there's lots of different ways that we can, or hazards that might happen. Say there's like a collision, falls during unloading, right? So we would just need to find all of those, list them all down. And then once we're done, it's going to generate this template for us. And then that is what we just need to assign to the team or individual who's going to complete the official JHA by, going through them in detail and kind of reporting on all of the different criteria around each hazard. And so once we do that, we would actually be going into either the portal or the Canvas app to fill that out. So here I've been assigned the post-risk assessment for pediatric nurses. So if I open this up, it's going to allow me to fill it out in a question-based format. So just give it a second to load here. And then this is almost like a more of like a SurveyMonkey experience where I can, for example, and you can customize the questions in these templates as well. So for example, I could ask for the employee ID or any other information I wanted to add here. But here now it's pulling up the things that I have used in the template. So the first step was administering medication, and there was a hazard for physical resistance from patients. So now I'm getting into those OSHA level questions around each hazard. So what's the probability? And I can select that. How often am I exposed to this? And then what's the potential severity of it? I can enter all of that. And then once I have filled this out, I can now mention any of these options. And then once I submit this, it's going to track and save all of this in the system. I'm not going to fill out the whole thing because it will take a long time. But once I've filled that out, it will essentially generate this report that is going to show me a summary of how many risks there were pre-control measure and post-control measure, the number of actions that need to be taken to improve the safety of this process, a breakdown of the hazard types that are relevant, and then another chart kind of showing the different hazards by their type as well. And then when I scroll down, this is where I can get a really detailed breakdown of the different activities and hazards that were reported, as well as the scores based on the OSHA scoring for whether or not they're like a very high risk or low risk once they are all multiplied together and giving that overall score. Similarly, I can see the control measures that were selected, the PPE, and then actions. So if there are any actions that the team needs to take to update the procedures, these are mentioned here. And in the system, this will actually generate an activity automatically. So now we have an action that's been created only for the records where that action question was filled out, but it will tell us exactly what we need to do. And then those can be assigned to a specific user to make sure that they are taken care of promptly and not forgotten about. So here, this is a task here. We can kind of assign it to a specific person. We can put a due date on it, and then we can mark it complete once we've taken that action, and then we'll know that we've actually made progress in improving our workplace safety. So that is pretty much the end-to-end flow there, but we do have approvals as well. So we can track the digital approvals, who approved it, what date did they approve it, and we can also set expiry dates. And then we have list views, so you can see, the ones that are upcoming to expire, and then you can make sure that you reassign those or redo those JHAs to keep everything up to date and in compliance.
Amazing. Thank you so much.
Of course. All right, I have stopped sharing my screen and should be back to you.
Thank you. Now, can you explain kind of the JHA and co-managers go hand in hand and the benefits of them?
Yeah, absolutely. So there's sort of two paths we see customers going with. If in a traditional model, they're either doing this all on their own, kind of in a paper-based or manual process, or they're outsourcing like entire consulting firms to do all of these assessments for all of their different user groups. So we kind of have a middle of the road approach. We want to enable you with this technology to kind of take things into your own hands. That said, we are there to guide you if you want to have a co-managed service. We'll provide like a dedicated JHA consultant who can kind of work with your different teams. So, for example, we're working with a large hospital in Indiana, and they have tens of thousands of employees. And so, for them to really go and do this for every single user role, it takes kind of a dedicated initiative. And so that's where we come in to kind of work department by department in order of priority. So, like nurses and, electricians and things like that are first on the list, but slowly going through the whole list of roles and working with each of those team leads to help them kind of customize their own assessment and then complete those and manage all of that reporting. So we do support this process to make sure it's smooth and easy through those co-managed service offerings if needed.
Great. So, as we mentioned, there is a lot of benefits that our job hazard analysis tool can provide, such as proactive identification of hazards, comprehensive documentation, regular compliance checks, and the most important one, mitigating legal and financial risk, which just means that by insurance compliance with federal, state, and local safety laws, hospitals and clinics can avoid penalties, lawsuits, and financial liabilities due to noncompliance or unsafe working conditions. So with that, we have now arrived at the Q&A section of our webinar. So if you have any questions, please feel free to ask and we can help answer those. So one of the questions we have is, what technologies are used with this?
So this solution is built only in the Microsoft ecosystem. So we are using Power Platform for the model-driven app and the Canvas app, and there's a Power Pages portal, and then we're using Power BI for the report. So yeah, as I mentioned before, these are something that you can access with your Office 365 user, but you would need the Power Apps premium license for the users who would be accessing the system or completing the JHA assessments.
Great. Piggybacking off of that, another question was, who are the users?
Yeah, so it depends on how your organization is doing it, and usually kind of on the size. If you have like a safety department, so they might be doing more of like the managing or admin aspects of it, and then giving access to, say, like the leads of different departments to be owning the JHAs for their own roles. And then you could also have situations where you could also have instances where maybe in a smaller organization you might have like one individual who's maybe doing them on behalf of everyone else. So it's really up to you, but whoever is going to be completing those job hazard analysis assessments would be the users of the system.
Great. Another question that we had was, what are the kind of reporting capabilities?
Yeah, so because we're in Microsoft, we have lots of flexibility when it comes to reporting. So out of the box, we provide a lot of dashboards and analytics on across all of your JHAs. You can drill down by your department, by hazard types, and things like that. And then we also have the automated JHA report that gives you those actionable insights for a specific process. However, we do have the ability, because it's in Power Platform, we can create custom dashboards, we can create custom Power BI dashboards, and we can also enable users to create their own dashboards if they would like as well. And then we have a lot of reporting and ability to like export the data and create different filtered views and work lists and things like that too.
Amazing. Another question that we have is, do we need to be using Microsoft to use the solution?
Yeah, so you would need the Microsoft Power Apps Premium licenses as well as Power BI for the reports.
Great. And last question is, where is the data stored?
Yeah, so because we're a built-in Power Platform, so our database is going to be Dataverse, which is Microsoft's cloud database, and it's going to be a solution that's deployed into your tenant of Power Platform, so you will have control and ownership of your own data within your own Dataverse database.
Amazing. So with that, as we wrap up today's session, I'd like to thank everyone for joining us for this important discussion on enhancing clinician and patient safety throughout proactive solutions. We hope we provided some valuable insights on how your organization can take the next step in workplace safety, compliance, and digital transformation. By partnering with Imperium Dynamics, you gain access to innovative solutions that address these challenges head on. Thank you, everybody, for joining, and we hope to see you next time. Thank you, Sarah.
Thanks, everyone. Happy Friday.
Bye.